Seminar 2-day 1 morning session, Fundamentals of Mentorship continued. Learning outcomes of this seminar are: understand the principles of person-centered recovery, recognize the role of advocacy in mental health, identify strategies for supporting mental health recovery, appreciate the importance of self-advocacy and strength-based approaches, recognize qualities of effective mentors in mental health recovery, gain practical skills for supporting mental health recovery, understand the importance of mentorship in substance use recovery, and identify key qualities sought in a mentor. Provide ongoing recovery support to individuals in substance use recovery, even after termination of formal services. AMI. Any mental illness, AMI, and serious mental illness, SMI, are terms used to categorize different levels of mental health conditions. According to the National Institute of Mental Health, AMI refers to a broad range of mental health disorders that can affect anyone at any point in their life. These conditions may vary in severity and can include anxiety disorders, mood disorders like depression, eating disorders, and substance use disorders. The impact of AMI on a person's life can vary widely depending on the specific disorder and its severity. For some, it may lead to difficulties in daily functioning, relationships, and work or school performance, while others may experience milder symptoms that are more manageable. NIMH, para 3. SMI. On the other hand, SMI specifically refers to more severe and persistent mental health disorders that significantly interfere with a person's ability to function in daily life. Examples of SMI include schizophrenia, bipolar disorder, and severe depression with or without psychotic features. Unlike AMI, SMI often requires ongoing treatment and support to manage symptoms and improve quality of life. The impact of SMI on individuals can be profound, affecting their ability to maintain employment, relationships, and overall well-being. NIMH, para 4. Notable trends. There's a notable trend indicating that individuals with more serious mental illnesses, SMI, tend to receive more consistent support compared to those with less severe conditions, AMI. Additionally, as individuals age, they are more likely to receive support for their mental health concerns. This pattern suggests potential resistance to treatment for younger populations. NIMH, para 5 to 15. One possible explanation for this trend is the perception that mental health issues are less severe or less deserving of attention in younger individuals. There might be societal biases or stigmas surrounding mental health, particularly among younger generations, which could discourage them from seeking help or receiving adequate support. However, it's crucial to recognize that younger generations often face unique challenges and stressors that contribute to their higher prevalence of mental health concerns. Factors such as academic pressure, social media influence, economic uncertainty, and rapid societal changes can significantly impact their mental well-being. To encourage care for younger populations, it's important to acknowledge the validity of their struggles and provide support tailored to their needs. One effective approach could involve promoting mentorship programs, where slightly older individuals or professionals who have experienced overcoming adversity offer guidance and support to younger generations. Mentors can serve as trusted allies who understand the challenges young people face and provide valuable insight, encouragement, and resources to help navigate through difficult times. By fostering a supportive environment that acknowledges the very real nature of the struggles faced by younger individuals and providing mentorship opportunities, we can help alleviate some of the barriers to seeking mental health care and promote overall well-being among younger generations. Risk disparities between AMI and SMI. When comparing the risk levels for certain behaviors or outcomes between individuals with any mental illness, AMI, and serious mental illness, SMI, notable disparities emerge. Understanding these differences is crucial for targeted interventions and support system. Behavior and outcome risks. 1. Substance use and addiction. Individuals with SMI have a significantly higher risk of substance use and addiction compared to those with AMI. The severity of their mental health condition often exacerbates vulnerability to substance use as a coping mechanism. 2. Suicide and self-harm. SMI, characterized by more severe and persistent mental health disorders, poses a greater risk of suicide and self-harm compared to AMI. The distress, impairment, stigma, and isolation associated with SMI can lead to heightened suicidal ideation and attempts. 3. Homelessness and housing instability. People with SMI face increased risks of homelessness and housing instability compared to those with AMI. The profound impact of severe mental health disorders on daily functioning and social support networks often contributes to housing challenges. 4. Incarceration. Individuals with SMI are more likely to experience incarceration compared to those with AMI. The intersection of untreated mental illness, substance use issues, and societal factors can increase the likelihood of involvement with the criminal justice system. What is the difference between any mental illness, AMI, and serious mental illness, SMI? Answer: AMI encompasses a broad range of mental health disorders that vary in severity and impact, such as anxiety disorders, depression, and eating disorders. SMI refers to more severe and persistent conditions like schizophrenia and severe bipolar disorder, which significantly impair daily functioning and often require ongoing treatment and support. Why might individuals with serious mental illness, SMI, receive more consistent support compared to those with less severe conditions, AMI? Answer: this trend may be due to the higher functional impairment associated with SMI, which necessitates more intensive and continuous support to manage symptoms and improve quality of life. Also, with AMI, outside actors may minimize the underlying challenges, saying they are common and something that can be gotten through without supportive services. What are some notable disparities in risk between individuals with AMI and SMI? Answer: individuals with SMI have higher risks of substance use and addiction, suicide and self-harm, homelessness, and incarceration compared to those with AMI. Chronological order of significant mental health disorders and severities. 1. Schizophrenia. Schizophrenia, a severe and chronic mental health disorder, often emerges in late adolescence or early adulthood. Its symptoms, including hallucinations, delusions, and disorganized thinking, significantly impair daily functioning. 2. Bipolar disorder. Bipolar disorder typically manifests in late adolescence or early adulthood and is characterized by mood swings between depressive and manic episodes. The severity of symptoms can lead to impulsive behaviors and functional impairment. 3. Severe depression with psychotic features. Severe depression with psychotic features presents a high risk of self-harm, suicide, and functional impairment. It can occur at any age but often emerges during adulthood. 4. Borderline personality disorder, BPD, characterized by unstable moods, relationships, and self-image, often emerges in adolescence or early adulthood. Its severity can lead to impulsivity, self-harm, and difficulties in interpersonal relationships. Understanding the chronological order of significant mental health disorders and their severities provides insights into the timing and nature of intervention strategies and support systems needed for individuals with AMI and SMI. Addressing these risks requires comprehensive approaches that consider both the mental health condition and its associated challenges. Understanding treatment options and levels of care. To effectively support individuals with substance, use, and mental health disorders, it's crucial to comprehend the range of treatment options and levels of care available. A comprehensive training program should provide insights into various modalities, including outpatient and inpatient services, as well as information on psychotropic medications for mental illness. Each treatment option may be considered a different pathway of care and support. Some people will prefer one over the other, some people will prefer neither, and some may find all equally beneficial. It is dependent on their preferences. Treatment modalities. 1. Counseling and therapy. Benefits. Counseling and therapy offer a safe space for individuals to explore their thoughts, emotions, and behaviors with a trained professional. They provide tools and coping strategies to manage symptoms, improve communication skills, and foster personal growth. Criticisms. Some individuals may perceive counseling or therapy as stigmatizing or intimidating. Additionally, the effectiveness of these modalities can vary depending on the therapeutic relationship and the approach used. Limitations. Counseling and therapy may not be suitable for individuals with severe mental health disorders who require more intensive interventions or those who have difficulty engaging in talk-based therapies. 2. Peer support and support groups. Benefits. Peer support and support groups offer individuals the opportunity to connect with others who share similar experiences, providing a sense of belonging, validation, and understanding. They offer practical information, encouragement, and emotional support. Criticisms. Some individuals may find peer support or support groups overwhelming or lacking in professional guidance. Group dynamics can also vary. potentially leading to conflicts or unhelpful interactions. Limitations. Peer support and support groups may not address the specific needs of every individual, and they may not be appropriate for those who prefer one-on-one support or who have social anxiety. 3. Life coaches and mentors. Benefits. Life coaches and mentors offer personalized guidance, motivation, and accountability to help individuals set and achieve goals, improve decision-making skills, and navigate life transitions. They provide practical advice and support outside of a therapeutic context. Criticisms. Some critics argue that life coaching lacks standardized training and regulation, leading to variability in quality and effectiveness. Mentors may also face challenges in maintaining boundaries and avoiding dependency dynamics. Limitations. Life coaching and mentoring may not address underlying mental health issues or provide the same level of support as professional counseling or therapy. They may be more suitable as adjunctive support rather than standalone interventions for mental health concerns. Can you explain the chronological order of significant mental health disorders and their severities? Answer. Schizophrenia usually has the most impact on functioning, followed by bipolar disorder, severe depression with psychotic features, and borderline personality disorder, each with varying degrees of severity and impact on daily life. What are some common treatment modalities for mental health disorders? Answer. Treatment options include counseling and therapy, peer support and support groups, and life coaching and mentoring, each offering different benefits and suitability depending on the individual's needs and preferences. Major support groups for mental health recovery. Support groups play a crucial role in mental health recovery by providing individuals with a sense of community, understanding, and encouragement. While support groups are done in conjunction with others, may be structured or semi-structured, the groups you choose to be a part of should be self-directed, which make them part of a self-help regimen. Here are 5 major support groups that offer valuable resources and peer support for those overcoming mental health challenges. 1. NAMI, National Alliance on Mental Illness. NAMI offers support groups facilitated by trained volunteers who have lived experience with mental illness. These groups provide a safe and confidential space for individuals and families to share their experiences, gain practical information, and receive emotional support. NAMI support groups emphasize empathy, acceptance, and empowerment. They cover a wide range of mental health conditions and topics, including coping strategies, treatment options, and advocacy efforts. 2. DBSA, Depression and Bipolar Support Alliance. DBSA support groups focus specifically on depression and bipolar disorder. Led by trained peers, these groups offer a supportive environment for sharing experiences, discussing symptoms, and learning coping skills. DBSA support groups provide education about mood disorders, self-help tools, and wellness strategies. They promote self-advocacy and encourage individuals to actively participate in their treatment and recovery journey. 3. Women Empowered. Women Empowered is a supportive community dedicated to empowering women from all walks of life. The group focuses on fostering personal growth, resilience, and empowerment through various activities, discussions, and support networks. They believe in the strength of women supporting women and provide a safe space for sharing experiences, challenges, and triumphs. The group offers a range of resources, including workshops, mentorship programs, and social gatherings, aimed at promoting self-confidence and self-reliance. Women Empowered embraces diversity and inclusivity, welcoming women of all backgrounds and identities. Together, they strive to uplift and inspire each other to reach their full potential and lead fulfilling lives. 4. Heads Up Guys. Heads Up Guys is an online resource and support community specifically designed for men experiencing depression. It offers peer support through online forums, personal stories, and practical tips for managing depression. Heads Up Guys provides a platform for men to connect with others who understand their experiences and challenges. It promotes open dialogue about mental health and encourages men to seek help without stigma or shame. 5. Radical Recovery Peer Support. Radical Recovery Peer Support introduces a holistic approach to recovery, incorporating self-care, recovery planning, and mentorship. It emphasizes the importance of peer support from individuals with lived experience and teaches fundamental principles such as honesty, trust, and self-advocacy. Radical Recovery Peer Support groups offer a supportive environment where participants can learn from each other's experiences and serve as positive role models for one another. The program teaches introductory information on peer support and mentorship, empowering individuals to become consistent and supportive mentors for others in recovery. Advocacy in mental health context. Advocacy plays a crucial role in mental health by promoting awareness, challenging stigma, and ensuring that individuals receive appropriate support and resources. In a mental health context, advocacy can manifest in various forms, including promoting person-centered recovery, advocating for holistic approaches to wellness, fostering self-advocacy, and upholding principles of individual choice and self-determination. Advocating for person-centered recovery. Advocating for person-centered recovery involves ensuring that services and interventions offered to individuals are tailored to their unique needs, preferences, and goals. It emphasizes the importance of recognizing each person as an individual with their own strengths, challenges, and aspirations. For example, advocating against recommending disability benefits to someone who wishes to continue working full-time respects their autonomy and empowers them to pursue their chosen path to recovery. Asking someone if they have thought about disability benefits or if they would like information about it is different than advising them to pursue it or simply giving them the information. Question: what is the difference between giving and offering? Advocating for a holistic approach to recovery/wellness. Advocating for a holistic approach to recovery emphasizes addressing all aspects of a person's well-being, including their mind, body, spirit, and environment. This approach recognizes the interconnectedness of various factors influencing mental health and recovery outcomes. By advocating for access to comprehensive services that address physical health, social support, housing, employment, and spirituality, individuals can achieve greater overall wellness and sustained recovery. Importance of self-advocacy in recovery/wellness. Self-advocacy empowers individuals to assert their needs, preferences, and rights in their recovery journey. The field of mental health recovery has been transformed by the persistent efforts of individuals advocating for themselves, leading to changes in treatment approaches, policies, and societal attitudes. By setting small goals, following through with the recovery process, and gradually building trust and credibility, individuals can enhance the effectiveness of their self-advocacy efforts. Applying principles of individual choice and self-determination. Advocating for individual choice and self-determination involves respecting each person's autonomy and right to make decisions about their own lives. Service providers should avoid imposing their own values or judgments on individuals and instead support them in making informed choices based on their preferences and goals. This approach fosters empowerment, dignity, and agency in the recovery process, enhancing the likelihood of positive outcomes. Advocating for rights and responsibilities in mental health recovery. Common rights people in mental health recovery expect. 1. Confidentiality. Individuals recovering from mental health challenges have the right to confidentiality, ensuring that their personal information and treatment details remain private and protected. 2. Choice of services. Individuals have the right to choose the mental health services and interventions that best meet their needs and preferences. This includes access to a range of treatment options and the ability to participate in decisions about their care. 3. Active participation in decision-making. Individuals have the right to actively participate in the decision-making process regarding their treatment and recovery plan. This involves being informed about available options, having their preferences respected, and collaborating with healthcare professionals to make informed choices. 4. Respect and dignity. Individuals have the right to be treated with respect, dignity, and compassion throughout their recovery journey. This includes being free from discrimination, stigma, and coercion in their interactions with healthcare providers and support services. 5. Informed consent. Individuals have the right to receive clear and comprehensive information about their treatment options, including the risks, benefits, and alternatives. Informed consent ensures that individuals can make voluntary and informed decisions about their care, recognizing signs of distress for mental health or reoccurrence of substance use. How does advocacy contribute to mental health support and recovery? Answer: advocacy plays a crucial role in promoting awareness, challenging stigma, ensuring access to appropriate resources, and advocating for individual rights and choices in mental health recovery. What rights do individuals in mental health recovery typically expect? Answer: common rights include confidentiality, choice of services, active participation in decision-making, respect and dignity, and informed consent regarding treatment options. Recognizing signs of distress is essential for providing timely support and intervention to individuals experiencing mental health or substance use challenges. Major indicators of distress or reoccurrence may include 1. Changes in behavior. Noticeable changes in behavior, such as withdrawal from social activities, increased irritability, or agitation, may indicate underlying distress. 2. Physical symptoms. Physical manifestations of distress, such as fatigue, changes in appetite or sleep patterns, unexplained aches or pains, or frequent headaches, should be observed and addressed. 3. Emotional symptoms. Expressions of intense emotions, such as sadness, anxiety, anger, or hopelessness, may signal distress. Individuals may also exhibit mood swings or sudden changes in emotional expression. 4. Cognitive symptoms. Cognitive symptoms of distress may include difficulty concentrating, memory problems, racing thoughts, or persistent negative self-talk. 5. Social withdrawal. Withdrawing from social interactions, isolating oneself from friends or family, or avoiding previously enjoyed activities may indicate distress. 6. Substance use. Increased substance use or reliance on substances to cope with emotions or stressors can be a sign of distress and may indicate the need for support. 7. Changes in functioning. Declines in functioning, such as difficulty performing daily tasks, maintaining personal hygiene, or fulfilling responsibilities at work or school, may suggest underlying distress. By being attentive to these signs and symptoms, individuals and support networks can intervene early and offer appropriate assistance and resources to promote well-being and recovery. 8. Return of risky behaviors, reverting to high-risk behaviors. Signs more common to substance use reoccurrence, but valid for distress of people with mental health challenges. 1. Denial or minimization. A. Denying or minimizing the severity of substance use or related problems. Lying, deception. A. Being dishonest about substance use or related activities. 3. Bargaining. Making excuses or bargaining with oneself or others to justify continued substance use or unhealthy behaviors. 4. Holding grudges, holding on to resentments or grievances, leading to increased anger and hostility. 5. Pupil changes. Physical signs such as pinpoint or dilated pupils, which may indicate substance intoxication or withdrawal. 6. Focusing on others. Obsessively focusing on the problems or behaviors of others as a distraction from one's own issues. 7. Cravings. A. Intense urges or cravings for substances. 8. Financial strain. A. Experiencing financial difficulties due to substance use. Harm reduction in mental health and substance use. Harm reduction involves strategies and approaches aimed at minimizing the negative consequences associated with mental health and substance use challenges, while prioritizing the well-being and autonomy of individuals. By focusing on reducing harm rather than demanding conforming to our idea of recovery, harm reduction principles aim to meet individuals where they are and support them in making positive changes at their own pace. Harm reduction is a critical pathway for some people in recovery. Simply choosing to eliminate a behavior isn't always possible, and a gradual and supported approach through harm reduction principles is beneficial. Harm reduction is something we can advocate for. There are some practices of harm reduction which are specific to substance use, which will be covered in the afternoon session of this seminar. Trauma-informed approaches. Reducing triggers, being trauma-informed, involves creating environments and interactions that minimize the risk of triggering traumatic reactions in individuals with a history of trauma. By understanding and acknowledging the impact of trauma, service providers can promote safety and trust in therapeutic settings. SAMHSA Tip 65, P82. More information about the trauma-informed approach can be found by taking our Seminar 1 course, Motivational Approaches. Empowering decision-making, motivational interviewing techniques focus on empowering individuals to explore their own motivations for change and make informed decisions about their substance use. By avoiding coercive or controlling approaches, motivational interviewing reduces the risk of exacerbating resistance or triggering negative reactions in clients. SAMHSA Tip 65, P92. More information about the motivational interviewing approach can be found by taking our Seminar 1 course. Family therapy approaches. Strengths and responsibilities. Family therapy approaches, guided by Salmatz's principle of strengths and responsibilities, guiding principles. Recognize the strengths and resources within individuals, families, and communities that can support recovery. However, it's essential to acknowledge that certain family dynamics or actions may pose challenges or even harm individuals in recovery. SAM-HSA Tip 65, P96. Cognitive behavioral approaches. Cognitive behavioral approaches focus on identifying and challenging negative thought patterns and behaviors that contribute to mental health challenges or substance use. These approaches help individuals develop coping skills, problem-solving strategies, and adaptive behaviors to manage symptoms and improve overall well-being. SAM-HSA Tip 65, P102. For instance, in mental health, a person experiencing anxiety may engage in cognitive behavioral therapy, CBT, to identify and challenge irrational thoughts that contribute to their anxiety symptoms. Through CBT techniques such as cognitive restructuring and exposure therapy, they learn to manage their anxiety more effectively and reduce the impact it has on their daily life. Cognitive behavioral approaches aim to identify and modify patterns of thinking and behavior that contribute to substance use and related problems. By addressing maladaptive thought patterns and developing coping skills, individuals can better manage cravings and triggers associated with substance use. Contingency management. Contingency management involves providing tangible rewards or incentives to reinforce positive behaviors and promote adherence to treatment goals. It operates on the principle of reinforcement, where desirable behaviors are rewarded, increasing the likelihood of their recurrence. SAM-HSA Tip 65, P115. For example, in a mental health treatment program, individuals may receive rewards such as gift cards, vouchers, or privileges for adhering to medication regimens, attending therapy sessions, or achieving specific milestones in their recovery journey. These incentives motivate individuals to engage in treatment and adhere to recommended behaviors, leading to improved outcomes. In substance use recovery, contingency management involves providing tangible rewards or incentives for positive behaviors, such as abstinence or attendance at treatment sessions. By reinforcing desired behaviors, contingency management can help individuals stay engaged in treatment and motivated to achieve their recovery goals. SAM-HSA Tip 65, P115. Mindfulness and acceptance-based approaches. Mindfulness and acceptance-based approaches emphasize present moment awareness, non-judgmental acceptance, and self-compassion. These approaches help individuals develop a mindful attitude towards their thoughts, emotions, and experiences, fostering greater resilience and emotional regulation. SAM-HSA Tip 65, P118. Suppose a person struggling with depression may practice mindfulness meditation to cultivate awareness of their thoughts and emotions without judgment. By learning to observe their experiences with acceptance and compassion, they develop coping skills to manage depressive symptoms and enhance their overall well-being. In substance use recovery, by developing mindfulness skills, individuals can better cope with cravings and distressing emotions associated with substance use. Cognitive behavioral approach, CBT. 1. Identifying negative thought patterns, CBT, helps individuals recognize and challenge negative thought patterns that contribute to their mental health challenges. These patterns often involve distorted thinking, such as catastrophizing, black and white thinking, or personalization. 2. Behavioral activation, CBT, encourages individuals to engage in positive behaviors that promote well-being and reduce symptoms of mental illness. This may include scheduling enjoyable activities, setting realistic goals, and increasing social interactions. 3. Coping skills development. CBT teaches individuals practical coping skills to manage stress, regulate emotions, and solve problems effectively. These skills may include relaxation techniques, assertiveness training, and problem-solving strategies. 4. Exposure therapy. In cases of anxiety disorders, CBT incorporates exposure therapy, where individuals gradually confront feared situations or stimuli in a controlled manner. This exposure helps desensitize individuals to their anxiety triggers and reduces avoidance behaviors. SAM-HSA Tip 65, P103. How CBT improves recovery. 1. Promotes cognitive restructuring. By challenging negative thought patterns, CBT helps individuals develop more balanced and realistic thinking. This cognitive restructuring reduces distress and improves mood, leading to better outcomes. Suppose a person may believe, "I'm worthless and incapable of anything." Through CBT, they learn to challenge this belief by examining evidence to the contrary and generating more balanced thoughts, such as, "I have strengths and achievements even if I'm currently struggling." 2. Enhances coping skills. CBT equips individuals with practical coping skills to manage stressors and navigate difficult situations. These skills empower individuals to effectively cope with challenges and setbacks, reducing the impact of mental health symptoms and craving of substances on their daily functioning. For instance, a person with anxiety disorder or substance use disorder learns relaxation techniques, deep breathing exercises, positive self-talk strategies, affirmations through CBT. When faced with a stressful situation, they use these coping skills to calm their anxiety and approach the situation with greater confidence. 3. Facilitates behavioral change. CBT encourages individuals to engage in positive behaviors that promote well-being and recovery. By setting achievable goals and implementing behavioral strategies, individuals gradually increase their participation in rewarding activities and reduce avoidance behaviors. For example, isolation. A person with social anxiety disorder gradually exposes themselves to social situations through behavioral experiments guided by CBT. As they confront their fears and receive positive reinforcement for their efforts, their anxiety decreases and their confidence in social settings improves. For a person in substance use recovery, positive experiences and behaviors can begin to replace the need for positive feelings engendered through use of substances. 4. Empowers active problem solving. CBT teaches individuals to approach problems analytically and develop effective solutions. By breaking down problems into manageable steps and generating alternative solutions, individuals gain a sense of control over their circumstances and feel empowered to overcome obstacles. Long-term maintenance, CBT, focuses on equipping individuals with the skills and strategies needed for long-term recovery maintenance. By addressing underlying cognitive and behavioral factors contributing to substance use and challenges to mental health, CBT helps individuals build a foundation for sustained abstinence/reduction of use or improved resilience and improved quality of life in both categories. Enhanced self-awareness. Through CBT, individuals develop a greater awareness of their thoughts, emotions, and behaviors. This increased self-awareness enables individuals to identify and address underlying issues contributing to their substance use or extreme feelings and compulsions experienced during a mental health challenge or crisis, and make informed choices about their recovery. Mindfulness in mental health recovery. Mindfulness is a practice rooted in Eastern meditation and spiritual traditions, adapted in Western treatment methods for recovery from problematic substance use and mental health issues. It involves purposefully paying attention to the present moment with non-judgmental awareness. By focusing on sensations, thoughts, and emotions as they arise, individuals cultivate a deeper understanding of their inner experiences and develop greater self-awareness. Oftentimes, where mindfulness practices are concerned, we actively focus on concentrating on healthy behaviors in the present moment that are developed through our own process of choice and preference. This is a practice a mentor can promote to their peers. How mindfulness works. Mindfulness works by encouraging individuals to observe their thoughts and feelings without reacting to them. Instead of getting caught up in worries about the past or future, mindfulness teaches individuals to anchor themselves in the present moment, fostering a sense of calm and clarity. Through regular practice, individuals learn to respond to stressors and triggers with equanimity, reducing the likelihood of reactive behaviors or relapse. Introducing mindfulness to clients. Mentees should be offered information about the relationship between stress and the recurrence of problematic behaviors, as well as the benefits of mindfulness in managing stress and promoting recovery. By explaining how mindfulness can be a useful tool in coping with cravings, urges, and difficult emotions, counselors can help clients understand the relevance of mindfulness to their recovery journey. Engaging in mindfulness practice. If counselors wish to incorporate mindfulness practices into recovery promotion, they should receive training in the fundamentals of mindfulness and incorporate it into their own lives. By practicing mindfulness exercises themselves, counselors can better understand the potential benefits and challenges that clients may experience. This enables counselors to anticipate reactions, responses, and tailor mindfulness interventions to meet the needs of their clients effectively. Throughout this book, specific mindfulness or relaxation exercises are presented in each afternoon session. These exercises include deep breathing, neck and shoulder rolls, body scanning, progressive relaxation, emotion surfing, and others. By integrating these practices into treatment sessions, counselors create opportunities for clients to develop mindfulness skills and cultivate greater resilience in their recovery journey. Things that apply to both mental health and substance use recovery. Importance of follow-up support. Following up with individuals after they terminate services is crucial for several reasons. 1. Continued support. It demonstrates to individuals that they are not alone in their recovery journey and that support is available even after formal services have ended. 2. Prevention of relapse. Regular follow-up helps identify any emerging challenges or triggers that could lead to relapse. By addressing these issues promptly, individuals can maintain their recovery progress. 3. Reinforcement of progress. Celebrating successes and acknowledging milestones achieved during recovery reinforces individuals' motivation and commitment to their ongoing journey. 4. Connection to resources. Follow-up sessions provide an opportunity to connect individuals with additional resources, support groups, or community services that may further enhance their recovery. 5. Feedback and reflection. Engaging in reflective discussions during follow-up sessions allows individuals to explore their experiences, identify areas of growth, and set new goals for their continued recovery. 6. Normalization of challenges. Acknowledging that setbacks or challenges are a normal part of the recovery process helps individuals feel supported and encouraged to persevere. 7. Building trust and rapport. Continued contact fosters a trusting relationship between individuals and support providers, creating a safe space for open communication and vulnerability. Qualities of an effective mentor. Empathy and understanding. An effective mentor understands the challenges of substance use recovery firsthand. For example, a mentor who struggled with alcohol addiction can empathize with someone battling alcoholism, offering insights and support based on shared experiences. 2. Personal experience. Individuals often seek mentors who have successfully navigated substance use or mental health recovery themselves. For instance, a mentor who has overcome opioid addiction can share their journey of recovery, offering hope and guidance to someone facing similar challenges. 3. Supportive and encouraging. A good mentor provides unwavering support and encouragement throughout the recovery process. They offer words of encouragement and affirmation, celebrating milestones and progress made by individuals in their recovery journey. 4. Active listening skills. Effective mentors listen attentively to the struggles and concerns of those they mentor. For example, a mentor actively listens to a mentee's challenges with cravings or triggers, providing empathetic support and practical strategies for coping. 5. Guidance and direction. Mentors offer guidance and direction to individuals seeking recovery from substance use. For instance, a mentor may help their mentee develop a relapse prevention plan or connect them with community resources such as support groups or counseling services. Obtaining these qualities as a mentor. Mentors can obtain these qualities by 1. Self-reflection and awareness. Mentors can cultivate empathy, understanding, and self-awareness through reflection on their own experiences, biases, and emotions. By acknowledging their own vulnerabilities and strengths, mentors can better connect with and support individuals in their recovery journey. 2. Continuous learning and growth. Mentors can enhance their knowledge and skills by staying informed about mental health issues, recovery principles, and evidence-based practices. Continuing education, training, and self-improvement efforts can help mentors better understand the needs of individuals and provide effective support. 3. Active listening and communication skills. Mentors can develop active listening and communication skills through practice, feedback, and self-reflection. By being fully present, attentive, and empathetic, mentors can create a supportive and trusting space for individuals to share their experiences and concerns. 4. Building trust. Mentors can build trust with individuals by demonstrating authenticity, consistency, and reliability in their interactions. By honoring commitments, maintaining confidentiality, and respecting boundaries, mentors establish a foundation of trust and safety in the relationship. 5. Seeking supervision and support. Mentors can seek supervision, consultation, and support from experienced professionals or peer mentors to enhance their effectiveness and address challenges in supporting individuals in recovery. Supervision provides mentors with opportunities for reflection, feedback, and guidance to improve their practice and better serve individuals' needs. How can mentors build and maintain trust with mentees? Answer. Mentors build trust by demonstrating authenticity, consistency, and reliability in their interactions with mentees. They honor confidentiality, respect boundaries, and follow through on commitments. Building trust fosters a supportive relationship where mentees feel safe to be vulnerable and seek guidance without fear of judgment. What benefits does supervision and support provide to mentors in their role? Answer: supervision and support from experienced professionals or peer mentors offer mentors opportunities for reflection, feedback, and guidance. It helps mentors navigate challenges, enhance their effectiveness, and ensure ethical practices in supporting individuals in recovery. This ongoing support contributes to mentors' professional growth and efficacy in their role. Afternoon session. Learning outcomes of this session are: the experience of being addicted, effects and experiences related to different drugs, and the healing process resulting from reduction of use or stopping use. Understand harm reduction as it specifically relates to substance use. Learn various facts and figures about substance use, recovery rates, overdoses, and factors that increase recovery rates. Understand what problematic substance use is, learn about recovery-oriented systems of care, learn different paths or roads to recovery from substance use. Relaxation exercise. Neck and shoulder rolls. Most of our tension is carried in our neck and shoulders. We can quickly reduce tension by doing neck and shoulder rolls. Understanding addiction and its challenges. Addiction to drugs or alcohol is a complex condition characterized by compulsive and uncontrollable substance use, despite adverse consequences. Individuals experiencing addiction often find themselves caught in a cycle of craving, using, and seeking relief, even when they desire to stop. This experience is driven by changes in the brain's reward system, leading to a profound sense of dependency on the substance. Experience of addiction. Those struggling with addiction may face intense cravings, which can be triggered by various factors such as stress, social situations, or environmental cues. These cravings often drive individuals to seek out and use drugs or alcohol, even when they are aware of the harm it causes. Additionally, addiction can lead to physical dependence, where the body becomes accustomed to the presence of the substance and experiences withdrawal symptoms when it is not consumed. Examples of addiction experience. Intense cravings. Those struggling with addiction may face intense cravings, which can be triggered by various factors such as stress, social situations, or environmental cues. These cravings often drive individuals to seek out and use drugs or alcohol, even when they are aware of the harm it causes. Physical dependence. Long-term substance use can lead to physical dependence, where the body adapts to the presence of the substance. Withdrawal symptoms, ranging from mild discomfort to severe illness, occur when substance use is discontinued or reduced. Impact on daily life. Addiction profoundly impacts various aspects of an individual's life, including relationships, work or school performance, physical health, and mental well-being. The compulsive need to use substances can lead to neglect of responsibilities, financial instability, legal problems, and social isolation. As addiction progresses, individuals may prioritize obtaining and using substances over other essential activities, disrupting their ability to lead a balanced and healthy life. Examples of drug effects. Opioids. Drugs like heroin and prescription painkillers can produce feelings of euphoria and pain relief. However, repeated use can lead to physical dependence and severe withdrawal symptoms such as nausea, vomiting, and muscle pain. Stimulants. Substances like cocaine and methamphetamine can increase energy, alertness, and confidence. However, they can also cause paranoia, agitation, and cardiovascular complications with prolonged use. Effects of different drugs. Different drugs exert their effects on the body and mind in distinct ways, categorized by their pharmacological classification. Depressants. Drugs such as alcohol, benzodiazepines, and opioids depress the central nervous system, leading to relaxation, sedation, and reduced anxiety. Over time, dependence can develop, increasing the risk of overdose and withdrawal symptoms. Stimulants. Substances like cocaine, methamphetamine, and prescription stimulants increase activity in the central nervous system, leading to heightened energy, alertness, and euphoria. However, they can also cause agitation, paranoia, and cardiovascular complications. Hallucinogens. Drugs like LSD, psilocybin mushrooms, and MDMA alter perception, mood, and thought processes, leading to hallucinations and profound changes in consciousness. Cannabis. Cannabis produces relaxation, euphoria, and altered perception. However, it can also impair memory, coordination, and cognitive function. Challenges in stopping drug use. Overcoming addiction presents numerous challenges, including physical dependence. Individuals may develop physical dependence on drugs, leading to uncomfortable withdrawal symptoms when they attempt to stop using. Psychological cravings. Addiction involves powerful psychological cravings for drugs, which can be triggered by stress, environmental cues, or social situations. Underlying factors. Addiction is often accompanied by underlying psychological, social, or environmental factors that contribute to its development and persistence. Stigma and shame. Stigma surrounding addiction can create barriers to seeking help and support, leading individuals to feel ashamed or judged. Relapse risk. Recovery from addiction is often characterized by relapse, with many individuals experiencing multiple relapses before achieving sustained sobriety. What defines addiction, and how does it manifest in individuals? Answer. Addiction is characterized by compulsive and uncontrollable substance use despite negative consequences. It manifests through cravings, dependence, and a cycle of seeking relief through continued use, even when individuals desire to stop. What challenges do individuals face in stopping drug use? Answer. Overcoming addiction involves physical dependence leading to withdrawal symptoms, powerful psychological cravings triggered by stress or environmental cues, underlying psychological and social factors contributing to addiction, stigma hindering help seeking, and the common occurrence of relapse during recovery. Healing process after quitting drug or alcohol usage. Initial withdrawal period. After quitting drug or alcohol usage, the body undergoes a process of detoxification, during which it eliminates the substances and begins to repair the damage caused by prolonged use. The initial withdrawal period can be challenging, as the body adjusts to functioning without the presence of the substance. Common withdrawal symptoms may include nausea, vomiting, headaches, anxiety, and insomnia. Physical healing. As the withdrawal period progresses, the body begins to heal from the physical effects of substance use. This healing process varies depending on factors such as the type of substance used, the duration of use, and individual health factors. However, over time, many individuals experience improvements in physical health, including organ function. Organs such as the liver, kidneys, and heart may begin to repair and regenerate damaged tissues, leading to improved function and overall health. Neurological recovery. The brain undergoes a process of neuroplasticity, where it adapts and rewires itself to function more optimally in the absence of drugs or alcohol. Cognitive functions such as memory, attention, and decision-making may gradually improve. Immune system. The immune system may strengthen, reducing the risk of infections and illnesses that were heightened during active substance use. Energy levels. Individuals often experience increased energy levels and vitality as their bodies recover from the fatigue and lethargy associated with substance use. Emotional and psychological healing. In addition to physical healing, individuals in recovery also experience emotional and psychological healing. This aspect of recovery is essential for addressing the underlying factors contributing to addiction and promoting overall well-being. Emotional and psychological healing may involve emotional stability. Individuals may experience greater emotional stability and resilience as they learn healthier coping mechanisms and strategies for managing stress and negative emotions. Improved mental health recovery allows individuals to address underlying mental health issues such as depression, anxiety, or trauma, leading to improved mental well-being and a greater sense of peace and fulfillment. Relationships. Healing from addiction often involves repairing relationships with loved ones and rebuilding trust, communication, and connection. Problematic substance use. Problematic substance use. According to SAMHSA in Tip 65, problematic substance use refers to a pattern of consuming alcohol, drugs, or other substances in a way that causes harm to the user's health, well-being, or ability to function in daily life. This behavior often disrupts personal relationships, work commitments, and educational pursuits. It can range from using a substance in a risky manner to developing a dependence or addiction to the substance. The term emphasizes the negative consequences that arise from such use, rather than the frequency or quantity of the substance consumed. Addressing the prevalence of problematic substance use. The prevalence of problematic substance use remains a significant public health challenge in the United States. According to SAMHSA's National Survey on Drug Use and Health, NSDUH for 2021, approximately 46.3 million people had a substance use disorder, SUD, in the past year. Among these, alcohol use disorder, AUD, was the most common, but the opioid epidemic continues to raise concerns. An estimated 5.6 million individuals had past-year opioid use disorder, OUD, in 2021. Impact of the opioid epidemic. The opioid epidemic has led to a surge in drug overdose deaths, with opioids being a primary contributor. In 2021, an estimated 80,816 drug overdose deaths involved opioids out of a total of 107,622 drug overdose deaths in the United States. This represents a concerning 15% increase from the previous year, underscoring the severity of the crisis. Additionally, deaths from stimulants like cocaine and methamphetamine also rose, reflecting a broader pattern of increasing stimulant-involved overdose deaths over the past 2 decades. Co-occurring substance use. A significant driver of the rise in stimulant-involved overdose deaths is the co-occurring use of stimulants and opioids. Some individuals intentionally combine these substances to balance their effects, while others may unknowingly consume stimulants adulterated with potent opioids, like fentanyl. This unintentional use underscores the complexity and danger of substance misuse and highlights the urgent need for comprehensive prevention and intervention efforts. Encouraging statistics on recovery. Despite the alarming rates of SUDs and drug overdose deaths, there are encouraging statistics on recovery. A study using 2018 NSDUH data found that of the U.S. adults who reported ever having a substance use problem, a significant majority, 74.8%, or approximately 20.6 million adults, reported being in recovery. Moreover, a cross-sectional study in 2019 revealed that the median number of serious quit attempts needed to overcome a significant substance use problem was surprisingly low, with the median being only 2 attempts. These findings suggest that recovery is attainable for many individuals, underscoring the importance of accessible and effective treatment and support services. Evolving views of problematic substance use. According to SAMHSA and TIP 65, throughout the 20th century, problematic substance use was often viewed through the lens of moral failure or weakness of character, perpetuating stigma and discouraging individuals from seeking help. This moral model placed sole responsibility on the individual for their substance use, contributing to the misconception that addiction was a choice rather than a complex condition. Shift to the chronic disease model. To counteract the damaging effects of the moral model of addiction, which viewed substance use disorders as moral failings or character flaws, addiction experts and healthcare professionals have increasingly advocated for the adoption of a chronic disease model. This shift in perspective reframes addiction as a complex medical condition, akin to other chronic illnesses such as diabetes or hypertension. To counteract the harmful effects of the moral model, addiction experts began promoting a chronic disease model of problematic substance use. This approach conceptualizes addiction as a chronic condition, akin to other medical illnesses, and highlights the role of biological factors in its development and persistence. By framing addiction as a disease, it becomes easier to justify scientifically based clinical interventions and advocate for insurance coverage and government funding. SAM, HSA, TIP 65, P9. Criticisms of the chronic disease model. Despite its widespread acceptance, the chronic disease model has faced criticism on several fronts. Feelings of hopelessness. Some argue that viewing addiction as a chronic disease can lead individuals to feel hopeless about their prospects for recovery, undermining their motivation to seek treatment or support. Neglect of environmental factors. Critics contend that the chronic disease model overlooks the significant role of environmental and social factors in contributing to problematic substance use, such as poverty, trauma, and social networks that endorse substance use. Inconsistencies in prevalence and recovery. The model fails to explain why only a minority of individuals who use substances develop addiction, and why many individuals are able to resolve problematic use without formal treatment. Sensitivity to external factors. Research indicates that substance use is sensitive to external factors such as price, availability, and social norms, which are not adequately addressed by the chronic disease model. Multifactorial approach to understanding problematic substance use. In response to these criticisms, some addiction researchers advocate for a multifactorial approach that considers the interplay of biological, psychological, social, and environmental factors in the development and course of addiction. This biopsychosocial model provides a more comprehensive understanding of problematic substance use and recovery, acknowledging the complexity of the condition and the diverse factors that contribute to its onset and persistence. Biological and psychosocial factors, genetics and epigenetics. Biological factors, including genetic predispositions and epigenetic changes, play a significant role in predisposing individuals to problematic substance use. Psychosocial factors. Various psychosocial factors, such as personality traits, mental disorders, pain, positive outcome expectancies, family and peer influences, and environmental stressors, contribute to an individual's vulnerability to addiction. Genetics and epigenetics. Biological factors. Genetic predispositions. Genetic factors contribute to approximately 40 to 60% of an individual's risk for developing addiction. Specific genes can influence susceptibility to substance use disorders by affecting brain chemistry, reward processing, and impulse control. Epigenetic changes. Epigenetics refers to changes in gene expression that do not involve alterations to the DNA sequence itself, but can be influenced by environmental factors such as stress, trauma, or substance use. These changes can modify gene activity and affect susceptibility to addiction over time. Psychosocial factors. Personality traits. Certain personality traits, such as impulsivity, sensation-seeking, and risk-taking behaviors, are associated with increased vulnerability to substance use disorders. Mental disorders. Co-occurring mental health disorders, such as depression, anxiety, bipolar disorder, or post-traumatic stress disorder, PTSD, often coexist with substance use disorders. These disorders can contribute to substance use, as individuals may use substances to alleviate symptoms or self-medicate. Pain. Chronic pain conditions can increase the risk of substance use, as individuals seek relief from physical discomfort through substances that provide pain relief or numbness. Positive outcome expectancies. Beliefs about the positive effects of substance use, such as stress reduction, social enhancement, or performance improvement, can influence initiation and continuation of substance use behaviors. Family and peer influences. Family history of substance use disorders and peer group norms that endorse or tolerate substance use can shape attitudes and behaviors related to substance use. Environmental influences. Environmental factors, ranging from substance availability to neighborhood disorganization, also influence the likelihood of problematic substance use. Stressful life events, trauma, socioeconomic disadvantages, and exposure to violence or abuse can increase vulnerability to substance use, as individuals may use substances as a coping mechanism. By adopting a multifactorial approach, researchers and clinicians can better understand the complexity of addiction and tailor interventions to address the diverse needs of individuals struggling with problematic substance use. What is the healing process like after quitting drug or alcohol usage? Answer. After quitting, individuals undergo detoxification to eliminate substances, facing withdrawal symptoms such as nausea and anxiety. Physical healing includes organ repair, neurological recovery through brain adaptation, immune system strengthening, and increased energy levels. Emotional and psychological healing involves stability, addressing mental health issues, and repairing relationships. How does a multifactorial approach enhance understanding of addiction and recovery? Answer. The multifactorial approach integrates biological, genetics, epigenetics, psychological, mental health, personality, social, family, peers, and environmental availability, norms, factors. This holistic view provides a comprehensive understanding of addiction's complexity and informs tailored interventions for effective recovery. Recovery-oriented systems of care for substance use recovery. Today we are experiencing great benefits of what is called a recovery-oriented system of care. This is something a great many people are advocating for. We can advocate for this based on the points of discussion that follow on the next 8 slides. These systems prioritize the individual's autonomy, strengths, and holistic well-being, aiming to provide personalized and empowering support across various domains of life. Key components of ROSC include person-centered approach. ROSC emphasizes the importance of tailoring services and interventions to meet the unique needs and preferences of each individual in recovery. Here, we advocate for this person-centered approach that recognizes that recovery is a deeply personal and individualized process, and that individuals should have a central role in decision-making and goal setting. Continuum of care. ROSC promotes a continuum of care that spans the spectrum of prevention, early intervention, treatment, and ongoing support. This continuum ensures that individuals have access to the appropriate level of care at different stages of their recovery journey, from initial engagement through to long-term maintenance of recovery. Holistic support. ROSC recognizes that recovery extends beyond the absence of substance use and encompasses various aspects of life, including physical health, mental well-being, social connections, employment, housing, and spirituality. As such, ROSC provides holistic support that addresses these diverse needs and promotes overall wellness and quality of life. Part of holistic support is its community focus, a key value of recovery. Moreover, holistic well-being is a key value that leads to resilience building. Collaboration and coordination. ROSC involves collaboration and coordination among various stakeholders, including individuals in recovery, families, peer support specialists, healthcare providers, social services, community organizations, and policymakers. This collaborative approach ensures that individuals receive comprehensive and integrated support that is responsive to their evolving needs. Peer support. Peer support is a cornerstone of ROSC, with individuals who have lived experience of recovery playing a central role in providing guidance, encouragement, and practical assistance to others on their recovery journey. Peer support offers a unique form of validation, empathy, and understanding that can enhance engagement, motivation, and resilience in recovery. Culturally responsive care. ROSC recognizes the importance of cultural competence and sensitivity in providing effective support for diverse populations. Culturally responsive care ensures that services are accessible, inclusive, and respectful of individuals' cultural backgrounds, beliefs, values, and identities. Recovery-oriented principles. At its core, ROSC is guided by recovery-oriented principles, including hope, self-determination, empowerment, resilience, and respect for diversity. These principles shape the design and delivery of services, fostering an environment that promotes growth, healing, and transformation for individuals in recovery. Many roads to recovery. Recovery from substance use disorders is not a one-size-fits-all journey, and individuals may choose different paths based on their unique needs, preferences, and circumstances. Supporting individual choice. Regardless of the chosen path to recovery, the role of supporters is to encourage and empower individuals to make their own decisions. Whether pursuing abstinence, moderation, harm reduction, or faith-based approaches, supporters offer non-judgmental guidance and assistance to help individuals navigate their recovery journey with autonomy and dignity. Ultimately, the diversity of recovery options reflects the complexity of addiction and the importance of individualized approaches to achieving lasting wellness. What are recovery-oriented systems of care, ROSC, and what principles do they emphasize? Answer: recovery-oriented systems of care, ROSC, are comprehensive and integrated approaches that prioritize individual autonomy, strengths, and holistic well-being in recovery. They emphasize principles such as person-centered care, continuum of care, holistic support, collaboration, peer support, cultural responsiveness, and recovery-oriented principles like hope and empowerment. How does ROSC promote a person-centered approach in supporting individuals in recovery? Answer: ROSC advocates for a continuum of care that spans prevention, early intervention, treatment, ongoing support, and aftercare/follow-up. This ensures individuals have access to appropriate levels of care at different stages of recovery, from initial engagement to long-term maintenance, promoting sustained recovery outcomes. Here are some common approaches to recovery. Abstinence. Abstinence involves completely stopping a behavior, such as substance use, to achieve recovery. This approach emphasizes total avoidance of the substance and may involve support from peers, therapy, and other interventions to maintain sobriety. STEP programs. STEP programs, such as Alcoholics Anonymous AA or Narcotics Anonymous NA, follow a structured series of steps aimed at addressing addiction. These programs typically involve admitting a lack of control over behavior, working with a sponsor, and making amends for past wrongs. STEP programs also include aspects of spirituality and belief in a higher power that is often referred to as God in some of the literature. Medication-assisted treatment, MAT. MAT involves the use of prescribed medications to support recovery from substance use disorders. Examples of medications used in MAT include methadone, buprenorphine, and naltrexone for opioid use disorder, and medications for mental health conditions like anxiety, depression, or PTSD. Moderation management. Moderation management focuses on reducing reliance on substances or behaviors rather than complete abstinence. Individuals actively work to limit their participation to a desired level, often with the support of therapy or peer groups. Harm reduction. Harm reduction acknowledges the reality of continued substance use, but aims to minimize its negative consequences. It does not require immediate abstinence, but encourages individuals to make positive changes at their own pace. Harm reduction strategies may include safer use practices, needle exchange programs, and overdose prevention education. Faith-based recovery. For some individuals, spiritual and religious groups provide a supportive environment for recovery. Faith-based organizations offer specific programs and resources to help individuals address substance use disorders while integrating spiritual beliefs and practices. Therapy. Therapy, provided by trained professionals in the healing arts, offers a structured and supportive approach to recovery. Conventional therapies, such as cognitive behavioral therapy, CBT, or dialectical behavior therapy, DBT, address underlying issues contributing to addiction and help individuals develop coping skills for relapse prevention. Smart Recovery. Smart Recovery is a self-help program that focuses on empowering individuals to overcome addictive behaviors through a science-based and self-empowering approach. Unlike traditional 12-step programs, Smart Recovery emphasizes self-reliance, evidence-based techniques, and cognitive behavioral strategies. Participants learn practical skills and tools to manage cravings, cope with urges, and change addictive behaviors, all within a supportive and non-judgmental group setting. Radical Recovery Peer Support. Liberation. Participants engage in peer-led support groups where they share experiences, exchange resources, and develop personalized recovery plans based on their own goals and values. Other support groups and non-clinical support. 11. Family therapy/support. Family is integral to the recovery process, and healing family bonds may be pivotal. In addition to Smart Recovery and Radical Recovery peer support, there are numerous other support groups and non-clinical resources available to individuals seeking recovery from substance use disorders. Some examples include Celebrate Recovery, a faith-based recovery program that combines Christian teachings with principles of recovery to support individuals in overcoming addictive behaviors. LifeRing Secular Recovery, a secular, abstinence-based support network that provides peer-led meetings and online forums for individuals seeking recovery from alcohol and drug addiction. Women for Sobriety, a support group specifically designed for women in recovery, focusing on self-help techniques, positive reinforcement, and empowerment. Moderation Management, a peer-led support network for individuals seeking to moderate their alcohol consumption rather than abstain completely. Find them at www.moderation.org. Online recovery communities. Various online platforms and forums provide a supportive space for individuals to connect with others in recovery, share resources, and access virtual meetings and resources. Moderation Management, a peer-led support network for individuals seeking to moderate their alcohol consumption rather than abstain completely. Seminar 2, Day 2. Morning Session. Learning objectives of this session are: understand some approaches to support the prevention of relapse/recurrence of use. Learn to advocate for person-centered recovery approaches and holistic wellness strategies tailored to individual needs. Learn other types of advocacy, including advocating for the rights of individuals receiving services as they relate to substance use recovery. Supporting prevention of recurrence. Supporters play a crucial role in helping individuals prevent recurrence of unwanted behaviors by offering alternative coping strategies and encouragement. Here are some ways supporters can assist: suggest alternatives, offer suggestions for healthier coping mechanisms or activities to replace the problematic behavior, provide validation, validate the individual's feelings and experiences while gently reminding them of their progress and accomplishments in their recovery journey. Encourage self-reflection. Encourage the individual to reflect on their triggers, vulnerabilities, and coping skills, and to explore ways to address underlying issues. Offer supportive listening. Listen attentively and non-judgmentally to the individual's concerns, struggles, and challenges, providing a safe space for them to express themselves without fear of criticism or shame. Promote self-care. Emphasize the importance of self-care practices such as mindfulness, relaxation techniques, exercise, and healthy nutrition to to support overall well-being and resilience. By recognizing signs of recurrence early and offering compassionate support and guidance, supporters can help individuals navigate potential challenges and setbacks on their path to sustained recovery and wellness. Harm reduction practices play a vital role in mitigating the risks associated with injection drug use. The next 9 slides promote services that may lead to an increase in healthy behaviors based on personal choice of the individual. When presented with good information and physical resources that promote healthy outcomes, many people gain a feeling of dignity and self-respect. Individuals who inject substances may also engage in high-risk sexual behaviors, increasing their vulnerability to other sexually transmitted infections, STIs. Learning how to administer a substance such as naloxone may prevent overdose from opioids. Safer injection practices. People who inject substances face increased risks of disease transmission, including HIV and hepatitis C virus, HCV, as well as potential damage to veins and soft tissue infections. Key practices for safer injection. Counselors can play a crucial role in promoting safer injection practices by discussing the following key areas with individuals in recovery. 1. Cleaning hands and skin. Emphasize the importance of thoroughly cleaning hands and the injection site with soap and water before injections to reduce the risk of infection. 2. Using sterile equipment. Encourage the use of sterile syringes and other injection equipment for each injection to prevent the transmission of bloodborne pathogens. Syringe services programs are valuable resources for accessing clean supplies. 3. Cleaning used syringes. In situations where new syringes are not available, individuals should be informed about the proper method of cleaning used syringes with bleach to reduce the risk of contamination. 4. Vein care and hygiene. Provide guidance on finding and caring for veins to minimize the risk of vein damage and infection. Proper hygiene practices following injections, such as cleaning the injection site and applying antiseptic, are also essential for preventing infections. Also, there are certain vitamins known for providing improved circulation and vein health. Subsequently, providing these vitamins to people who inject drugs may increase health. Promoting safety and well-being. According to the CDC, by equipping individuals with knowledge and resources to practice safer injection techniques, counselors can empower them to reduce the harms associated with injection drug use. CDC, para 1-8. Safer injection practices not only protect individuals from infections and health complications, but also promote dignity, autonomy, and overall well-being in their recovery journey. Syringe services programs. Syringe services programs, SSPs, play a crucial role in harm reduction efforts by providing individuals who inject substances with access to clean needles and syringes. These programs aim to reduce the transmission of bloodborne infections, such as HIV and viral hepatitis, among people who inject drugs. By offering sterile injection equipment and other harm reduction services, SSPs contribute to improved health outcomes and promote safer practices among individuals with problematic substance use. CDC, para 5. Effectiveness of syringe services programs. Decades of research have demonstrated the effectiveness of SSPs in reducing the spread of bloodborne infections and improving health outcomes among people who inject drugs. Studies have shown that individuals who utilize SSPs are more likely to enter substance use disorder treatment and are more successful in reducing or ceasing their drug use compared to those who do not access these programs. CDC, para 1-10. Specifically, new users of SSPs are 5 times more likely to enter substance use disorder treatment. Individuals who utilize SSPs are approximately 3 times more likely to stop using drugs compared to those who do not access these programs. Comprehensive sexual health education and services. Recovery organizations that provide harm reduction services recognize the importance of addressing sexual health alongside substance use issues. By offering comprehensive sexual health education and services, these organizations aim to empower individuals to make informed choices about their sexual health and reduce the risk of sexually transmitted infections, STIs, and unintended pregnancies. Sexual or reproductive health services are part of holistic care centered around physical health. Reproductive health services. The CDC acknowledges that recovery organizations that offer harm reduction services, such as syringe services programs, often provide a range of reproductive health services, including condom distribution, providing free or low-cost condoms to individuals to promote safer sex practices and reduce the risk of STIs and unintended pregnancies. CDC, para 28. Birth control distribution, offering access to various forms of contraception, such as birth control pills, patches, injections, and intrauterine devices, IUDs, to help individuals prevent unintended pregnancies, CDC, para 29. Prescriptions for HIV prevention medications. Recovery organizations may offer prescriptions for medications such as pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP. PrEP is a daily medication taken by HIV-negative individuals to prevent HIV transmission, while PEP is a short-term treatment taken after potential exposure to HIV to reduce the risk of infection, CDC, para 28. Importance of sexual health education. In addition to providing reproductive health services, recovery organizations prioritize sexual health education as part of their harm reduction approach. Comprehensive sexual health education covers topics such as STI prevention, educating individuals about the transmission and prevention of STIs, including the importance of condom use, regular STI testing, and communication with sexual partners. Contraception, providing information about different contraceptive methods, their effectiveness, and how to access them. HIV prevention, raising awareness about HIV transmission and prevention strategies, including the use of PrEP and PEP, as well as the importance of regular HIV testing. Consent and healthy relationships, promoting understanding of consent, boundaries, and healthy communication in sexual relationships to prevent sexual violence and promote positive sexual experiences. Empowering individuals. By offering comprehensive sexual health education and services, recovery organizations empower individuals to take control of their sexual health and well-being. Access to reproductive health services and information supports individuals in making informed decisions about their sexual practices, reducing the risk of STIs and unintended pregnancies, and promoting overall health and resilience in their recovery journey. Advocacy in drug and alcohol recovery. Buckley, advocacy plays a crucial role in supporting individuals in their journey of recovery from drug and alcohol addiction. It involves speaking up, raising awareness, and influencing policies and practices to ensure that individuals with substance use disorders receive the support and resources they need to achieve and maintain sobriety. Here are some reasons for and methods of advocacy as they specifically relate to drug and alcohol recovery. 1. Advocate for person-centered recovery. One of the fundamental principles of advocacy in drug and alcohol recovery is advocating for person-centered recovery. This means ensuring that the services and interventions offered to individuals in recovery are tailored to their unique needs and preferences. Rather than adopting a one-size-fits-all approach, advocates should advocate for a personalized approach to recovery that takes into account factors such as the individual's history, strengths, challenges, and goals. For example, advocating against recommending disability benefits to someone who wishes to continue working full-time highlights the importance of aligning services with the individual's aspirations and capabilities. 2. Advocate for a holistic approach to recovery. Another key aspect of advocacy in drug and alcohol recovery is advocating for a holistic approach to recovery that addresses the mind, body, spirit, and environment. This holistic approach recognizes that recovery encompasses more than just abstaining from substance use. It involves promoting overall wellness and addressing underlying issues that contribute to addictive behaviors. Advocates can promote the integration of mental health support, physical health care, spiritual guidance, and environmental factors such as housing, employment, and social support networks into the recovery process. 3. Promote self-advocacy. Self-advocacy is an essential component of recovery from drug and alcohol addiction. It involves individuals speaking up for their own needs, rights, and preferences, and actively participating in decisions related to their recovery journey. Advocates can empower individuals in recovery to become effective self-advocates by providing them with information, resources, and support to assert their needs and make informed choices. The field of substance use recovery has been positively impacted by the persistent efforts of people in recovery themselves who have advocated for greater access to treatment, reduced stigma, and improved support services. By encouraging self-advocacy, advocates can help individuals take ownership of their recovery and build confidence in their ability to navigate challenges and achieve their goals. Rights of individuals in substance use recovery to be advocated for. Individuals in substance use recovery have certain rights that should be respected and upheld by service providers. These rights include 1. Confidentiality. Individuals have the right to confidentiality regarding their personal information, treatment history, and recovery journey. Service providers must ensure that sensitive information is kept confidential and shared only with authorized personnel in accordance with applicable laws and regulations, such as HIPAA. 2. Choice of services. Individuals have the right to choose the types of services and treatments that align with their recovery goals and preferences. Service providers should offer a range of options and support individuals in making informed decisions about their care. 3. Active participation in decision-making. Individuals have the right to actively participate in the decision-making process regarding their treatment and recovery plan. Service providers should involve individuals in discussions about their goals, preferences, and concerns, and collaborate with them to develop personalized plans that reflect their unique needs and circumstances. 4. Respect and dignity. Individuals have the right to be treated with respect, dignity, and non-discrimination throughout their recovery journey. Service providers should create a supportive and inclusive environment that values the worth and humanity of each individual, regardless of their background or circumstances. 5. Access to information. Individuals have the right to access accurate and relevant information about their condition, treatment options, and available resources. Service providers should provide clear and understandable information to help individuals make informed decisions about their care. How effective are syringe services programs, SSPs, in supporting individuals who inject drugs? Answer. SSPs have proven effective in reducing the spread of bloodborne infections like HIV and hepatitis C. Individuals who use SSPs are more likely to enter substance use disorder treatment and reduce or cease their drug use compared to those who do not access these programs. What reproductive health services are typically offered by recovery organizations that emphasize harm reduction? Answer. These organizations often provide condom distribution, various forms of birth control, and prescriptions for HIV prevention medications like pre-exposure prophylaxis, PrEP, and post-exposure prophylaxis, PEP, to prevent unintended pregnancies and reduce the transmission of sexually transmitted infections, STIs. How does advocacy support individuals in drug and alcohol recovery? Answer. Advocacy supports individuals by promoting person-centered and holistic approaches to recovery, empowering self-advocacy, and ensuring rights such as confidentiality, choice of services, active participation in decision-making, respect, dignity, and access to accurate information. Supporting drug and alcohol recovery. Supporting individuals in their journey of drug and alcohol recovery is a multifaceted process that requires empathy, understanding, and active engagement. Here are several ways to effectively support someone in their recovery journey. 1. Provide non-judgmental support. Approach the individual with empathy and understanding, free from judgment or criticism. Show them that you are there to support them unconditionally, regardless of past mistakes or setbacks. 2. Encourage treatment and professional help. Encourage the individual to seek professional help and engage in evidence-based treatment modalities such as counseling, therapy, and medication-assisted treatment. Offer to assist them in finding resources and accessing appropriate treatment services. 3. Promote self-care practices. Encourage the individual to prioritize self-care practices that support their physical, emotional, and mental well-being. This may include regular exercise, healthy eating habits, adequate sleep, and stress management techniques. 4. Offer practical assistance. Offer practical assistance to help alleviate stressors and barriers to recovery. This could involve helping with transportation to treatment appointments, providing childcare support, or assisting with household chores. 5. Foster positive social connections. Encourage the individual to build and maintain positive social connections with peers, family members, and support groups. Offer to accompany them to support group meetings or recovery-oriented social events. 6. Empower through choice. Empower the individual by respecting their autonomy and involving them in decision-making processes related to their recovery. Offer options and allow them to choose the path that aligns best with their values and goals. 7. Provide emotional support. Be a compassionate listener and offer emotional support during challenging moments. Validate their feelings and experiences and reassure them that they are not alone in their journey. 8. Celebrate milestones and achievements. Recognize and celebrate the individual's progress, no matter how small. Acknowledge their achievements and milestones in sobriety and reinforce their sense of accomplishment and resilience. 9. Set boundaries. Establish clear boundaries and communicate expectations for behavior that supports recovery. Encourage healthy boundaries within relationships and environments that promote sobriety. 10. Be patient and persistent. Recovery is a journey with ups and downs, and progress may not always be linear. Be patient and persistent in your support, offering encouragement and reassurance even during setbacks or relapses. Recovery support. Individual choice and self-determination in recovery. Individual choice and self-determination are foundational principles in the recovery journey from drug and alcohol addiction. They emphasize the importance of individuals having the autonomy and freedom to make decisions about their own lives and recovery paths. However, these principles can be undermined when service providers impose their own expectations, judgments, or criticisms on individuals in recovery. Here's how such actions can defeat the concept of choice and self-determination. 1. Imposing expectations. When service providers demand certain changes in behavior or dictate what individuals should or ought to do, it restricts their freedom to make choices based on their own needs and preferences. This can create a sense of coercion or pressure, undermining the individual's autonomy and sense of agency in their recovery process. 2. Judging or criticizing behaviors. Service providers who judge or criticize certain behaviors of individuals in recovery may inadvertently reinforce feelings of shame, guilt, or inadequacy. This can erode their confidence and self-esteem, making it harder for them to assert their own preferences and make decisions that align with their values and goals. 3. Warning of certain behaviors. While it's important for service providers to educate individuals about potential risks and consequences associated with certain behaviors, constant warnings or admonishments can be disempowering. Instead of empowering individuals to make informed choices, it may instill fear or anxiety, leading to a sense of powerlessness and dependency on external guidance. 4. Defeating choice and self-determination. Overall, when service providers fail to respect the autonomy and agency of individuals in recovery, it undermines the principles of choice and self-determination. Recovery is a deeply personal journey, and individuals should be supported in making decisions that best serve their own well-being, rather than being dictated to or judged by others. Assisting individuals in recognizing and building on their strengths and resiliencies. Assisting individuals in identifying and building on their strengths and resiliencies is crucial for fostering sustainable recovery from substance use. Here's why. Empowerment. Recognizing and acknowledging one's strengths and resilience can empower individuals to take ownership of their recovery journey. 2. Motivation. Highlighting strengths and resiliencies can serve as a source of motivation and inspiration during difficult times. 3. Problem solving. Building on strengths allows individuals to leverage their positive attributes and resources to address obstacles and barriers to recovery. 4. Self-discovery. Exploring and recognizing personal strengths can foster self-discovery and self-awareness. 5. Resilience building. Actively cultivating resilience can enhance individuals' ability to bounce back from setbacks and challenges in recovery. Where can I work in substance use recovery? In the field of substance use recovery, there are various settings where individuals can pursue meaningful and rewarding careers. Some of these include recovery community organizations, RCOs, and recovery community centers, RCCs. RCOs and RCCs are nonprofit organizations dedicated to supporting individuals in achieving long-term recovery from substance use disorders. These organizations offer a range of services, including advocacy, peer support, public education, and recovery-focused activities. Working at an RCO, or RCC, allows individuals to directly engage with the recovery community and provide valuable support to those in need. Rehabilitation clinics. Rehabilitation clinics provide comprehensive treatment and support services to individuals with substance use disorders. Employment opportunities in rehabilitation clinics may include roles such as counselors, therapists, case managers, and support staff. Working in a rehabilitation clinic allows individuals to play a vital role in facilitating the recovery process and helping clients achieve sobriety and wellness. Intensive outpatient programs, IOPs, and outpatient programs. Intensive outpatient programs, IOPs, and outpatient programs offer structured treatment and support services for individuals with substance use disorders who do not require residential care. These programs typically include counseling, group therapy, education, and support services. Employment opportunities in IOPs and outpatient programs may include counselors, therapists, social workers, and support staff. Correctional facilities. Prisons and correctional facilities may also offer employment opportunities in substance use recovery. Many correctional facilities provide substance use treatment programs for incarcerated individuals to address their substance use disorders and support their rehabilitation and reintegration into society. Employment opportunities in correctional facilities may include counselors, therapists, case managers, peer supporters, and support staff. What are recovery community organizations, RCOs? Recovery community organizations, RCOs, are nonprofit entities that play a vital role in supporting individuals with substance use disorders on their journey to long-term recovery. These organizations are often led and staffed by individuals with lived experience of recovery and provide a range of services and activities aimed at promoting and sustaining recovery. According to SAMHSA, source, SAMHSA Peer Specialist Support in Recovery, RCOs engage in various activities, including advocacy. RCOs engage in advocacy efforts to promote policies and practices that support recovery, reduce stigma, and improve access to treatment and support services. Peer support services, RCOs, offer peer support services both on-site and at other organizations. Peer support provided by individuals with lived experience of recovery is a cornerstone of RCOs and has been instrumental in helping individuals achieve and maintain recovery. Running recovery-focused institutions. Some RCOs operate recovery-focused institutions such as Recovery Community Centers, RCCs, which provide a welcoming and supportive environment for individuals in recovery to connect, access resources, and participate in recovery-oriented activities. What are Recovery Community Centers, RCCs? Recovery Community Centers, RCCs, serve as local hubs of community recovery support, primarily led by individuals with lived experience of recovery. These centers play a crucial role in providing a supportive and inclusive environment for individuals seeking to overcome substance use disorders and maintain long-term recovery. Key features of RCCs include peer support services. RCCs offer peer support services, which are provided by individuals who have first-hand experience with recovery. Peer support involves offering empathy, understanding, and practical assistance to others on their recovery journey. Peer support can take various forms, including one-on-one interactions, group meetings, and informal gatherings. Substance-free social and recreational activities. RCCs organize substance-free social and recreational activities to promote healthy and enjoyable alternatives to substance use. These activities may include arts and crafts workshops, fitness classes, outdoor excursions, movie nights, and community events. By providing opportunities for social connection and engagement, RCCs help individuals build supportive relationships and strengthen their recovery networks. Recovery support meetings and coaching. RCCs host recovery support meetings and offer individualized coaching and guidance to support individuals in achieving their recovery goals. These meetings may include peer-led support groups, educational workshops, and skill-building sessions focused on topics such as relapse prevention, coping strategies, and goal setting. Recovery coaches provide personalized support and encouragement to help individuals navigate the challenges of recovery and maintain their progress. Linkage to resources and opportunities. RCCs facilitate access to employment and individuals in rebuilding their lives after substance use. By connecting individuals with community resources and services, RCCs empower them to pursue personal and professional growth and achieve their full potential in recovery. Additional services and support. In addition to core services, RCCs may offer a range of supplementary services to address the diverse needs of their members. These services may include self-care activities, such as yoga and meditation, legal assistance for issues related to recovery, and family education or support groups to help loved ones understand and navigate the challenges of supporting someone in recovery. Many RCCs also provide meeting space for mutual help organizations, such as Alcoholics Anonymous and Narcotics Anonymous, to hold their meetings. How can imposing expectations or judgments on individuals in recovery undermine their autonomy? Answer: imposing expectations or judgments can restrict individuals' freedom to choose their recovery path based on their unique needs and preferences. It can create feelings of coercion or inadequacy, eroding their sense of control and self-agency in the recovery process. What is the significance of assisting individuals in recognizing and building on their strengths and resiliencies in recovery? Answer: assisting individuals in recognizing and building on their strengths and resiliencies empowers them by enhancing motivation and problem-solving skills, fostering self-discovery and self-awareness, increasing their ability to bounce back from setbacks, providing a source of inspiration during challenging times. How can supporters assist individuals in preventing recurrence of unwanted behaviors? Answer: supporters can assist by suggesting healthier coping mechanisms, providing validation of progress, encouraging self-reflection on triggers and vulnerabilities, offering supportive listening, and promoting self-care practices like mindfulness and exercise. What are key practices for safer injection discussed by counselors? Answer: key practices include cleaning hands and injection sites, using sterile equipment, proper syringe cleaning methods, and maintaining vein health to reduce risks of infection and other health complications related to injection drug use.